Today we're discussing urinary incontinence with Dr. Niall Galloway, who is a urologist with Emory Healthcare. Dr. Galloway is going to be answering questions that have been sent in over the internet from our members. First up is a question that came in from one of our members over Twitter, who states that she actually has stress incontinence but is too embarrassed to seek medical help. Dr. Galloway, is there anything that you can say to her to allay her fears about seeking medical help?
Well, I think the first thing you need to know is that this is a very, very common problem. This is a problem that is part of the human condition. And more than half of all of the patients, all of the female patients over the age of 55 have some kind of bladder control problem. It is a problem that is very, very common in the elderly. And if we look at athletes at college who are in their teens and 20s, 20% of these patients will also have urinary control problems that will stop them from doing what they want to do. So don't feel like you're the only one who has this problem.
Hi, Dr. Galloway. I'm 54 years old, and my biggest fear is becoming incontinent as I grow older, and I would like to know what I can do to prevent that from happening besides doing Kegel exercises. Is there anything else?
We do inherit our pelvic floor characteristics in the same way that we inherit things like the color of our eyes and the color of our hair. And so if your mother has these kinds of problems and you look like your mother, then it's likely that this is something that is in your future. There are things that have nothing to do with heredity that have more to do with how many babies, how many pregnancies have I had, how many vaginal deliveries have I had. There are other things that have to do with simple, ordinary kind of problems like weight gain. And if you are significantly over your ideal weight, you're more likely to have problems with urinary leakage. And those problems will get better oftentimes with moderating your weight.
Dr. Galloway, at what age should I talk to my daughter about pelvic floor health?
You can't really start too young to talk about these parts of the body. Unfortunately, in our society, these structures that are below the belt are rarely talked about. And of course, so much of the core of a woman's health rest on and are contained within the pelvic floor. The pelvic floor is critical not only for bladder function, but for bowel function and sexual function and for reproductive health. And so it's a very important part of the body.
Dr. Galloway, I've heard a lot about Kegels and other pelvic floor therapies, but do they really work?
Yes, it does. Pelvic floor therapy is very effective. But building muscle in the pelvic floor is a little bit like building muscle elsewhere in the body. And the paradox with pelvic floor muscle exercise is that you need to have some muscle in order to be able to build muscle on top of that muscle. Unfortunately, most patients who have severe incontinence also have weakness that takes the form of thinning of these muscles in the pelvic floor. Those patients with smaller, thinner muscles are going to have much more difficulty trying to build on top of that muscle because the improvement that you get is proportional to how big the muscle is before you start. One of the things that is relevant here too is that there are predictable things that may damage the pelvic floor, and one of those is childbirth. And there's quite strong evidence that if you can learn how to do your exercises before childbirth or before your pelvic surgery, that this will stand you in very good stead and give you an outcome and a recovery interval that will be much more straightforward.
Dr. Galloway, what is the biggest myth associated with incontinence?
I think the biggest myth is that somehow your continence reflects your competence. We imagine that because we come into this world as little babies who can't control their bladder, and we often leave as elderly, senile patients who don't know how to control their bladder, that somehow urinary leakage in the middle is a reflection of your mental capacity. Urinary leakage 99 times out of 100 has to do with your structure. If you're having problems with your pelvis and your pelvic organs, it's usually because something is just not as it should be. And many of the things that are wrong with patients in the pelvis can be corrected, if not by simple conservative, non-surgical ways, then often by surgical intervention.
Dr. Galloway, thank you so much for joining us today. This has been great information. If you'd like more information about urinary incontinence, please go to our website at www.sherwick.com.